All right, parents, every day in practice, I take a case history of either an older child who's had too many rounds of antibiotics as an infant and young child, or we begin care with another infant whose nervous system, gut, and immune system are an absolute mess due to antibiotics. For 2 decades now, the research has been very clear that pediatricians continue to overuse antibiotics for common things like ear infections and respiratory infections. And the short-term side effects are not good, but the side effects are an even bigger problem. This video is for mom and dads who do not want to give their children another round of antibiotics or have not yet found a natural solution to help with their ear and respiratory infections and are looking for another way. In this video, we'll break down the long-term side effects of antibiotics, including development of antibiotic resistance, chronic health conditions, and autoimmune disorders, and even disruption of the microbiome, which is your gut. I know because I personally was a child of the 80s and had so many antibiotics I can't even count. As an adult, I've had to heal my gut and undo all of the damage that those antibiotics created. So the first thing we do is we empower and educate our parents to be an advocate for their child's health, especially when it comes to understanding antibiotics are not always necessary for treating certain infections such as viral illnesses or mild ear infections. Overuse of antibiotics can lead to antibiotic-resistant bacteria, which can be difficult or impossible to treat in the future. The main thing antibiotics disrupt that really wreck kids' long-term health are weakening and suppression of the immune system and disruption of the gut microbiome, disruption of neurotransmitters and the gut-brain communication, and development of antibiotic resistance. The real root problem with the use of antibiotics for things such as ear and respiratory infections is they don't address the root cause, which really is poor plumbing and bad drainage and an imbalance of the neuroimmune system. The original factors that trigger that poor drainage and neuroimmune function in kids are generally birth intervention, birth trauma like forceps, vacuum, and even C-sections. There's a lot of research between C-sections and respiratory and autoimmune challenges later in life for kiddos due to not only disruption of the microbiome, but also upper cervical subluxation and the physical tension that disrupts the function of the vagus nerve and the autonomic nervous system regulation and immune function and inflammation. That's the chiropractic part. As a neurologically focused pediatric chiropractor, our priority is to get to the root cause of the ear infection and respiratory infection and to be the first stop for natural drug-free solutions for families so they don't have to resort to antibiotics. So if you want more information on how the upper cervical spine can affect the plumbing and have immune system issues, please head to our website, check out the documents that we have there. You can also find them from our Facebook page or our Instagram page. Ask us any questions, send us a DM, give us a call. We'd love to share our information with you. We'd love to help you raise happy and healthy kids that are drug-free. So let us help.